I'm right now in Dehradun, and where we have this entire landslides and absolute disconnect from the world. And in these areas, the biggest challenge is the communication. How do we actually access when there is a disaster and provide medical and health care to the people there? Customized telemedicine, of course, is an emerging trend which is pretty much prevalent in the European nations. And home healthcare for elderly or the underserved, homebound patients with chronic illness, allowing monitoring and treatment through economical and time-efficient technologies. Now, the three things we're looking at is easier accessibility to patients, cost effectiveness, time efficiency, and integration of communication, information technology, and health sciences. Now, that increases scope for research and development. Now, what is the sustenance of the sustainability of telemedicine is the biggest question we've been trying to pose ourselves. And the implementation of telemedicine caters to three main social aspects of sustainability through addressing needs at the grassroots levels, ease of healthcare and management by the government, and the social responsibility of the government. Implementation of telemedicine in India is cost effectivity, and grassroots level care is a lucrative social initiative in developing nations, and this is something we're trying to capitalize on in the north, and this is what we've been working on and we had a pilot project which actually took off. But we're not very sure, we're still in the stage where we even come out with, I would say, extremely positive results, but I'm sure this would actually be a possibility in the near future. There are a couple of trends, challenges and suggestions for effective implementation. This is pretty much what I've been saying. The biggest challenge still remains the laws of regulation of practice in India as also in the global perspective. There are no clear-cut laws which actually regulate any of these medical practices which have innovation or information technology imbibed in them. The biggest challenge for a developing nation like ours is the inhibition and resistance to adopt and adapt new unknown technologies. Of course, training and education users have to create initiative and interest in utilizing the telemed and e-health tools which are available. And the other methodology that is challenging, despite the advanced ICT, is the mobile healthcare system for reaching the doorsteps of the rural populace. Now, the challenges are manifold, but we are coming up with a lot of solutions when it comes to strategically providing remote healthcare service and also remote healthcare education. Well, I don't have an immediate reply, but then yes, the imposition and formulation of stringent laws and regulations for the reliable and accountable practice of telemedicine, we believe, is the need of the hour. Thank you very much for the opportunity.
It was insightful of you. We'll have to break. Sam Petroda is on the line. We'll be seated here and we'll continue back.
The webcast camera range is limited. So please request you to come ahead and sit here so that he can catch you. The signals won't go beyond the third row. The camera cannot catch you beyond the third row. So please request you to all please sit here. Those who are standing in the back, can I request you to please come here, please? Ready? There he is. Sam Petroda, good evening.
Good morning and good evening, Dr. Sam Petroda. Can you hear us?
I can hear you very well.
Thank you, sir. On behalf of all the attendees at the 3rd International Conference, we are extremely grateful to you at 6 o'clock in the morning to address all of us. There are several hundreds of us physically listening to you. But in addition to this, this conference is being webcast, and we understand several hundreds from several dozens of countries are also listening to you. This has been a very exciting 2 days, and we know that you are the one who introduced telephones in the time of Rajiv Gandhi, and you literally made what at that time we thought was impossible possible, and we are looking forward to this address, and we do hope that you will help us make our dream of transforming healthcare with ICT a reality in this country. Over to the audience.
Thank you. Distinguished delegates, prominent doctors, engineers, members of the business community, the role of ICT in transforming healthcare systems. I thank the organizer for this opportunity. Healthcare has been a great challenge all over the world. As we know, costs have been going up, demands have been increasing, and there are
conference. You are currently the only participant in the conference. You are currently the only participant in the conference. You are currently the only participant in the conference. You are currently the only participant in the conference. You are currently the only participant in the conference. You are currently the only participant.
I'm sorry, there is a transient interruption here. We hope we'll get back to you in a couple of seconds. Yes, sir, we're back online.
Sorry. Now, I was just saying that the challenge is universal, and everyone world over is looking for information and communication technology to help transform the healthcare systems. Particularly in India, problems are even more complex. Just last week, I addressed a group in India, in Delhi, with large number of government officers on universal healthcare systems. There I really commented on the need to focus on 5 areas. I want to re-emphasize that to set the stage required to focus on ICT. Because ICT in isolation cannot deliver the kind of results we expect. So I believe we need to upgrade our existing institutions and infrastructures substantially. All our health infrastructure needs serious attention. I've been to All India Medical Institute, I've been to government hospitals, I've been to primary healthcare centers, and some of these institutions are absolutely pathetic in terms of cleanliness, facilities, services, and unless and until we focus on improving existing infrastructure, no amount of IT is going to help us in the long run. 2, we need to substantially upgrade our human resource. We need more doctors, more trained nurses, more paramedical workers, more support system. And we know how much effort it requires to get a permit to start a new medical college. We know that we just don't have enough doctors for a country of 1.2 billion. 3, we have really not taken advantage of the traditional health system. I always give this example that my mother delivered 8 children in a small little town in Orissa, tribal village, no electricity, no water, no doctor, no pharmacy, no nurse. All 8 out of 8 turned out to be mentally healthy, physically healthy, and went on to do very interesting things in their own life. They must have done something right. Zero cost of delivery. I think we have lost a great deal of wisdom from the past. We really don't take advantage of traditional medicine. Not that it's a solution for everything, but it is definitely has huge impact on lifestyle management. Eating right, exercising, understanding some of our food, roots, tradition, and the need to innovate, need to combine traditional, modern medicine and not just rely on high-cost solutions which really address the challenges of the people at the top of the pyramid. If India is to make a dent in health services, we will have to really focus on affordability, scalability, and sustainability. And that can only come from innovative new models of delivering health services. And that's where ICT can play an important role. Fortunately, we are a nation of a connected billion. Now we have 900 million mobile phones. For the first time in the history, we have connectivity everywhere. But that's the starting point. I've been saying recently that the first phase of the telecom revolution is about to end. But the second phase of the telecom revolution is about to begin. And that relates to broadband for everybody. And some huge amount of investments are being made in this area for health industry to capitalize on. As you know, we have built a national knowledge network to connect 1,500 nodes with 40 gigabit bandwidth to connect all our universities, all our R&D laboratories, all our major hospitals,